यादव यादव
Assalamu alaikum, everybody.
عليكم السلام ورحمة الله. Professor Ahmed.
Welcome.
You have already your presentation with you. Are you going to present from your end, or you would like us to share the PowerPoint slides?
I'm going to share from my own.
All right, so please start sharing.
Yes.
Sharing, I would like to greet Dr. Ahmed. And
Yes.
also, I just mentioned leadership engagement. Actually, he's one of the people I was referring to.
Thank you very much. Thank you very much, Professor. The screen visible for everybody.
Brilliant. Yes.
Thank you.
طيب بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله سيدنا محمد وعلى آله وصحبه أجمعين. Ladies and gentlemen, thank you very much for joining our last session for day one, Sudan Health Professional Education Conference, SHEDCON 2023, where we will have several of our colleagues in the field give us some of the dose of rhabdocide in research working in this area and supporting the concept of evidence-based practice in health profession education. We will start today by Dr. Ahmed Umar, Professor Ahmed Umar, who will present an assistant professor of Surgeon University of Bahri. He will present with us his research titled Core Clinical Procedures Skill Learning in Undergraduate Public Medical Schools and at Khartoum State. Professor Ahmed, the microphone and the floor is yours.
Thank you. Good evening, everybody. First, I would like to extend my thanks to the organizing and scientific committee for accepting this paper for presentation in this elegant conference. Actually, this area is a dark area in health professional education and undergrad level. The core clinical procedure skills in undergraduate level in public medical schools at Khartoum State. It's a piece of work done for the master's degree in health professional education at the University of Khartoum. I would like to extend my thanks to Professor Alumni Sahel al-Mardi. He is the co-author and the supervisor of this work. In fact, mastery of the core procedure skills is becoming fundamental part in undergraduate medical education, and as stated by many international competency frameworks. And traditionally, the learning of the procedures is an opportunity, utilize opportunistic model of the teach one, do one, see one, do one, and teach one during their clerkship. And this is acceptable for the other clinical procedure like clinical skills like history taking, examination, and so on. But when we come to the area of procedural skills, it will be very dangerous to perform these in patients. During clerkship, it has been found that clerkship does not automatically provide a powerful learning environment for procedural skills learning, as stated by many studies. And medical students entering the internship, usually they have a very wide range of experience because of different background. And the training of procedures during internship is usually opportunistic. Nowadays, globalization of medicine mandates that the medical graduates should be competent at various levels of medical education, including mastery of clinical procedure skills, so as to be fit on track. And for that reason, many international frameworks had adopted essential lists in their frameworks for procedures training. And it became a structured method, way of teaching procedures, not like in the past ad hoc ways. They utilize the both facility and college-based training, and the Python 4-step approach has become very popular in undergrad and postgrad level. Briefly, this method of instruction includes 4 steps in which the trainer perform the procedure first silently, and then he deconstruct the procedure while he's talking through, while performing the procedure. And then the learner talks through while the trainer is still performing the procedure. And lastly, the learner perform the procedure. Assessment usually missed in the past, but it is important to make sure that the candidate is progressing. In Sudan, recently there has been a boom in establishment of medical schools, and the admission rates increasing annually as a central policy of Ministry of Higher Education. Personally, I don't know what's the reason. And so the states of clinical procedure skills learning in such situation is unclear, and it is not addressed. Our objective in this study is to look at the core procedure skills learning in undergraduate public medical schools in Khartoum State from 2 perspectives: from the perspective of the curricular content and from the perspective of learning, perceived learning by the medical students. Specifically, we want to look at the content of the procedural skills in the curricula of these 5 public medical schools. And also we want to look at the perceived competencies in different various procedures by the medical students themselves. And we would also look at the teaching and assessment methods utilized in this learning. This is a cross-sectional study done at the 5 public medical schools, namely University of Khartoum, University of Bahri, and Nilan University, Umdurman Islamic University, and Zaim Al-Azhar University. And we use 2 sets of data, the curricular content and the final year public medical students. Of the 1,372 medical students, 205 responded to our online Google questionnaire, and the curricula were assessed by a checklist. The procedural skills were drawn out from the international competency frameworks, namely the Tomorrow's Doctors, the Scottish Doctor, the American Association of Medical Colleges, and the Association of Faculties of Medicine of Canada, and others like Australian and Saudi Med, and so on. The instrument consists of 30 items of therapeutic procedures and 22 items of diagnostic procedures and 5 procedural activities. The student perceived learning is taken as a tool for assessment of the competency of the students, and the competency is assessed by 5-point Likert scale. If the candidate is between 1 to 3, it is regarded as incompetent, while if the candidate is in 4 and 5, it's regarded as competent. So this scale is converted into binary scale at the end. The ethics is obtained from the Research Ethics Committee from the University of Khartoum. So the results, we look at the two sets of data, as I mentioned earlier. For the curricula, the planned curricula, all medical schools has stated that the learning of procedural skills is one of their intended learning outcomes. 4 of the schools, they intended to teach these skills during the clinical phase and one during the preclinical phase, and they emphasize it later in clinical phase. All schools declare utilizing both facility and college base for assessment for learning, and unfortunately, the procedural content in the curricula is found very deficient. Only 25% of the procedures in the list are found in our curricula, agreed upon by the whole 5 colleges. Regarding the teaching and assessment methods in the curricula document, none of the 5 curricula adopted the 4 Python method, 4-step or instructional method, and none has mentioned that they should utilize specialized part task trainers for learning procedures. Regarding assessment, all curricula stated that formative assessment is the method of assessment, and one curricula added summative assessment at the end. 60% of the schools depend on logbook for assessment. Regarding the medical student perceived learning, our cohort is mainly females. 38% of the students admit that they learn procedures during their clinical round, and this is dangerous. And 32%, they say that they learn procedure skills by their own personal effort without any instruction from the faculty. And 57% of the students stated that they utilize both learning, both college and facility-based learning, and one third of the students they rely on the facility-based, and only around 7% of the students they rely on the school-based. From the various types of or combinations of the methods used by the students for learning procedures, 1/4 of the students depend on practicing procedures on patients, and this is dangerous. Only 8% of the students utilize the skill labs, and that highlight where are we. When we ask the student further, do you have a skill lab in your school? Around 40% they said yes, and 30% they said no. But surprisingly, 20% of the students, they don't know whether they have a skill lab in their schools or not. And this highlight that the skill labs are not utilized well in learning procedures by our medical schools. Regarding the student perceived learning, here is the problem. 2%, only 2% of the students in the 5 public medical schools are feeling competent to perform the 57 procedures listed in the checklist. And this is not related to the gender type or the school, and not related to the method of learning. Regarding the peri-procedural activities, they are very deficient in infection control and giving consents for the patient before the procedures. And regarding diagnostic procedures, they are deficient. Only 1% of the students are competent on diagnostic procedures, and proctoscopy, which is a common procedure, is performed only by around 3% of the students. Regarding therapeutic procedures, the overall competency is 4%. And when we look closer, we found that around 30% of the students felt competent to perform basic life support skills, and only 20% of the students can perform neonatal resuscitation, and 10% of the students can do external cardiac massage. This list of procedures shown in the table have never been seen by more than 50% of the candidates. Regarding alignment of the curricula with the perceived learning of the student, when we look at this is the actual list, the list of the procedures. 25% of the procedures are agreed upon by the 5 colleges, and the rest are variable between different colleges, curricula. But also 25% of the procedures are not stated in any one curriculum at all. And surprisingly, the competence of the student performing these procedures are variable. It's very heterogeneous. So in conclusion, ladies and gentlemen, there is no consensus about the core procedures training in our public medical schools, and it is clear that the skills are not packed with skill labs for the purpose. The learning of procedures is still opportunistic in our medical schools, and none of the medical schools has a structured instructional design. Clearly, there is a misalignment between the curricula and the perceived learning in terms of content, instructional design, and assessment method and outcome of learning. The logbook is the major tool for assessment, and it has been proven that it has very low validity and reliability. And the yield, as I mentioned, is only 2% of the students are competent doing it. So recommendations from this paper, they should be setting of a national list of core procedural skills for undergraduate medical curricula is highly recommended. And the formal procedural skill curricular framework is a fundamental to improve the perceived learning by the medical students. And structured training is mandatory. And formative assessment is needed to make sure that our students are progressing. Uh, Public medical schools should have proper simulation-based curricula, and well-equipped with skill labs to enhance procedural training. Finally, I think further studies should be conducted in this area, looking in depth in how the different medical schools at private sector and public sector are implementing
Thank you very much once again, Professor Ahmed, for the very fruitful presentation. Indeed, it handles a very important issue, and it adds for sure a lot to the evidence-based practice in the health professional education. I will invite the participant to write their questions in the Q&A section. Probably we'll take the question after the presentation at the end of the session. Once again, thank you very much, Professor Ahmed, for your presentation. We'd like also to take this opportunity to invite Dr. Marwa Muhammad to present to us her work, her research work titled Determination of Learning Style of Dental Students and the Relation to Their Satisfaction and E-Learning through Moodle at the Faculty of Dentistry, Nilane University, a cross-sectional study in 2021. Dr. Marwa Muhammad, please share your slides, and the microphone on the floor is yours. Dr. Ahmed, would you please mute the mic?
Okay, thank you.
Dr. Marwa?
Assalamu alaikum.
Alaikum assalam. Would you like us to share for you the PowerPoint slide, or are you going to share from your end?
I will try to share it. 1 minute, please.
All right.
Okay. Maybe it's better to share from you, please, Dr.
I'm on it. Just give me 1 second.
Okay. Okay. It's done. I think it's done now.
It's not in the presentation mode.
Yes.
If you allow us to share it from our side,
Okay. It will be better.
you can stop sharing from your end. Thank you.
Okay. Assalamu alaikum. Can you hear me? Did you hear me? Assalamu alaikum.
Yes, wa alaikum salam. We can hear you. The screen is up, and the
Okay.
floor is yours.
Thank you. Welcome everyone at this conference. I am Marwa Muhammad Al-Amin Ibrahim Ali, Orthodontics Consultant, MSc of Orthodontics, Khartoum University, MScs of Health Professional Education, Sudan Medical Specialization Board, and many thanks to my supervisor, Professor Al-Walid Al-Amin. Today, inshallah, I will present learning styles of dental students and its relation to their satisfaction with e-learning through Moodle among Faculty of Dentistry, Milan University 2021, a cross-sectional study. Content, introduction, research question, objective. Okay, welcome. Just an introduction. Learning style is the way that different students learn. The variation in ability to gather and integrate information. Efficient transfer of information from teacher to student can be complicated by mismatches between teachers' teaching strategy and student learning style. Each learner could adopt to one learning style or combination of multiple styles. Learning style, visual, tactile, the other name is kinesthetic, auditory, and read and write learning style. Knowledge of learning style can contribute to the implementation of pedagogical approach in order to improve student performance. Recently, online learning is becoming more accredited and gained more acceptance among university students globally. Faculty of Dentistry, Milan University, is one of medical faculties in Sudan that applied a good asynchronous e-learning during pandemic of COVID-19 and up to date. Despite expansion of e-learning, no published data concerning its relation to learning style of undergraduate dental students in Sudan is available. Research question: what's the preferable learning style for dental students at Milan University? What's the satisfaction level of dental students regarding e-learning? Objectives: to determine the learning style preference among dental students at Milan University, to assess the satisfaction with e-learning among dental students at Milan University, to correlate the relationship between learning style and satisfaction with e-learning. Materials and methods. It's a descriptive cross-sectional study from September to November 2021 at Faculty of Dentistry, Milan University, Khartoum, Sudan. Faculty of Dentistry at Milan University was established by Sudanese Higher Education in 2005. The first batch were accepted in the same years. Now there is 17 batch in the faculty. Sample size was calculated using EPI calculator. The total population from first to fifth year is 564. The sample size is 229 students with 95 confidence level. Sampling technique, stratified random sampling. The list of students from year 1 to year 5 was obtained from the academic affairs. Participants were selected from the list. The interval was obtained from the population over sample size is 2.4. The starting point was selected randomly. Each participant was given detailed explanation of the investigation and the procedure to be undertaken. Informed consent was obtained from each participant. Each year, representative student was contacted and requested to distribute a link of survey to their colleagues on live self-administrated semi-structured questionnaire as data collection tool was used. Questionnaire consisted of 3 sections: socio-demographic information, learning style questionnaire, and satisfaction level questionnaire. Social demographic: age, gender, academic care level. Learning style questionnaire: 24-point questionnaire adapted from University of Texas Learning Center. 6 questions were added to questionnaire to assess read and write learner. Satisfaction level questionnaire: a research instrument according to Likert scale with 6 level. The tool aimed at measuring the satisfaction level of students toward the use of e-learning. Data management, descriptive analysis, frequency and percentage, mean and standard deviation, chi-square, p-value 0.05 or less considered as statistically significant. SPSS version 17 was used. Next, please. Ethical consideration. Ethical clearance was obtained from EDC, Sudan Medical Specialization Board Ethical Committee. Result and discussion. The majority of sample were females, okay? Type of learning, 40% were found to prefer kinesthetic learning. It's the preferred type of learning in all students, followed by 30% visual. Gender and preferred type of learning, kinesthetic learning was preferred by male student. There is statistically significant relationship between gender and learning style were found. Learners were moderately satisfied with e-learning. Okay. This is satisfaction level questionnaire. It consists from 28 items. 5 of them were strong, 1 weak, and the others were moderate. Generally, satisfaction level were, please go to the next. Satisfaction level, the mean was about 3.2, which is moderate, okay? The highest one was using e-learning and virtual class is suitable solution at time of pandemic. The weakest one was learning through e-learning and virtual classes increase the interaction between student and the instructor. The others are moderate. Okay, next. Satisfaction with e-learning in relation to categories of participants, statistical significant relation were found between age and satisfaction with e-learning. No statistical significance between learning style and e-learning. No statistical significance between learning style and satisfaction. Conclusion, the preferable learning style was the kinesthetic learning style. The success of e-learning is dependent on multitude factors: computer literacy, the availability of appropriate technology, accessibility, and having good high bandwidth internet connection. Although Sudanese dental students may encounter some difficulties, they are still generally satisfied with e-learning experience. The study conducted only in one dental faculty, but it was a heterogeneous study, and therefore the result can be comparable to students on the other university. Multimodal learning style was not included. Thank you very much. If there is any question, you are welcome.
Thank you very much indeed, Dr. Marwa, for the nice presentation Yes, once again, I invite my colleague, the participants, and the attendees to write their questions in the Q&A section. And we will handle it, inshallah ta'ala, by the end of the session. So our third talk will be presented by yes, by Dr. Tahra Sadiq Al-Mahdi. Once again, we are very honored to have you with us today in this session. Dr. Tahra, inshallah, will present to us a topic, the effect of Sudan's April 2023 war in medical education and prospects for recovery. Thank you very much in this very important topic, Dr. Tahra, and the microphone and the floor is yours.
شكرا جزيلا. بسم الله الرحمن الرحيم. السلام عليكم. Thank you very much, Dr. Hisham, for these kind words, and I welcome you all. And I'm sure that all of us are really tired now. It's a long day, but this is, I think, a very important topic that touches upon all of us. So I'll start. It's a study, or it's a paper that we wrote, Professor Fahal and myself, and it's now under consideration, inshallah, to be published soon. My name is Tahra Sadiq, and I work at Ahfad University for Women as the director of the Medical Education Unit. I also coordinate the Master of Health Professions Education at Sudan Medical Council, and I also act as a teacher in the online component of the Master in Maastricht University. So the roadmap to my talk, I'm going to give a quick background about the problem, the aim of this review, and how we gained insight, what is happening right now, and what are the lessons learned. And I think it links nicely with most of what is said and what is going to be said, inshallah. So if we consider the background of Sudan, the slogan بتاع أرض الحضارات, the country of civilizations, it's not a cliche, it's a true thing. And a lot of studies shown that one of the earliest civilization in human history started in Sudan. And we have all these very good illustrations of Sudanese who rose up and made their print for humanity in general and for Sudan specifically. And if we consider what's happening now, the country, for let's say it's a recent or it's a small section of our history. It's not all our history, but we are now on the plunging side of our history. هي شوية من عمر الزمان لكن كثيرة علينا إحنا, because we are living it. We hope that we'll get over it while we're still there in this world. So we plunged into it's a vicious cycle of military coups, and then revolutions, and then short-lived democracies, and then again another military coups that left us with this situation of people displaced from their houses, a country with very which is blessed by wealth of natural resources, but it's down to earth regarding its economy, the livelihood of its people, all such things. And now we came to what's happening now, which is the topic of our study. And here you can see that what happened to our institutions, the higher education institutions, especially in Khartoum and in, of course, the war affected Khartoum and the western part of our country. And now you know about the escalation. We hope that things will go for the better, inshallah. But what happened to the universities and most of the civil institutions, complete devastations of institutes. And there is a study which is referenced here that claims that 100% of universities were destroyed either by bombardment or by looting or problems of the sort, and of course the people who fled. So if we consider our medical education system, actually it's one of the very earliest in the region, maybe number 2 or number 3, number 2 or 3, yeah, in the Arab world. We started more than or about a century ago our medical education, and I'm talking specifically about medical education. Of course, the midwifery started earlier, but medical education in 1994, and it expanded until it's now reaching a number of 86 medical schools. Professor Ahmed earlier asked what the cause of this, and we can discuss it maybe in the discussion session. So we started. We can see that our education system or education history, medical education history. I can see that there are 3 maybe distinct phases. There is the establishment phase, and where Khartoum University, Kitchener School of Medicine started. And then maybe half a century after that, there was community like discontent or disappointment from us internationally and also in Sudan. And of course, what derives change in medical education, as I said earlier, it's the people's needs and also the professional needs. So from a professional needs point of view and needs and people needs, they both culminated to tell us as medical professionals that we have to change our education system. They were the Al-Ma'ata Declaration, you all know about it. Anyhow, this made the change for community oriented medical education in general. And Sudan opened 2 universities, Genizira University and Juba University. And then there was the revolution in higher education, which is in 1990, and it continued, whereby there was huge development in the number of medical schools. The motive is good. The motive is you want to develop the places, you want to give more opportunity for people to bridge the gap, the needs for medical professionals, but the implementation was defective. And so it took us to the fourth stages, the 4th stage of accreditation. So the aim is to see the ongoing of the crisis and explore potential solutions. So we obtained insight from different sources, literature, of course, on the subject, about people, how they dealt with conflict times in medical education. We also participated in talks with medical students, in webinars, and with deans of medical schools and with experts in medical education to find their insight about the problem. So we started by trying to identify pre-existing problems or challenges. For example, there were several writings about the shortcoming of basic education. So students come to the medical schools with deficiency gap that some people try to cover by maybe like preparatory programs. Admission, no autonomy at all regarding admission. So admission is completely governed by the Ministry of Higher Education, and we have a problem here because if we're going to be socially accountable, then or to control our quality, then we need to have a say in what people, which type of graduates or people recruited to the school that we need to allow with us. Also, there is unregulated privatization. In 2019, 50% of the medical schools were private and they were on the rise. And most of them, more than 70% of them were in Khartoum. This immediately gives a problem of the training. Clinical training is very problematic now. People are not finding places to train their students. And also there is irrelevant content because there were no proper contextualization of curricula. They are taken immediately from where they're taken and they are implemented. Ineffective teaching methods. We are mainly dependent on conventional ways of teaching, high student to faculty ratios, and dichotomy, complete dichotomy between health system and education system. So we're not sure, are we really bridging the gap? Are we really producing the people that the health system needs or not? Poor research, poor attention to research and empirical data, feminization of the profession. Two of my colleagues, the one prior to my talk, talked about the number of females in the profession, and this is worldwide. Females are taking up higher education, and it can be, many countries try to deal with it in a just way, not to say stop females from entering the profession, but in a just way how to deal with that. Also, low community trust, and this was reported by Professor Zenkarar, for example, that a lot of the complaints that come to the medical council, that it shows that there is a trend that people are not trusting doctors, the hostilities or the violence against doctors. All these phenomena shows that there is a problem. And also we have traumatized students. For example, now for maybe 4 years, students there is repeated disruption of their education, and they don't know what's going to happen. And now, زي ما بقولوا هي في البير وقع فيها الفيل. So for our medical students and all our students, they're really suffering a lot psychologically, and this cannot make them very much attentive to their education, because part of being focused in learning is to be safe, for as you know. So war brought not only more challenges, a threat that the whole country is going to explode. So war is a real threat on the country. The first problem is that atrocities are ongoing. So every day we are finding new problems and new tragedies are happening, unfolding. So this is by itself is a problem. Institutions in the conflict zone, as I said, maybe 100% of them suffered. More than 11 persons till maybe a month ago dead. Thousands are injured, and more than 6 million fled their homes internally or outside the country, but they're not stable. Education was stopped, of course, across the whole Sudan. The Ministry of Higher Education did that in the beginning, and we're going to see. And this, of course, some of the experts said this contributed to a new wave of brain drain. So we already had more than 60%, until empirically tested, was until 60% of people are just leaving the country. And of course, after all these conflicts, I'm sure that the percentage is going to be higher. Safety. Students are not safe in wherever they are now, not only physical safety, also psychological safety. So how can we make them attentive to their studies? There are vulnerable students who are in their transitional stages, who are in their final years, who cannot transfer from the university, and who have their certificates to be issued and they cannot be issued. So this is a problem. There is the main problem is the problem of uncertainty. We don't know what's the future is holding for us. So this is again a problem. worldwide, people say that it is as if we're living the age of disasters. Disasters are on the increase, natural and man-made, like war, for example, on the increase. And in countries where there are up to, I think, 65% of countries, poor countries, are going to suffer also from conflicts, because poverty also is very much linked to conflict and the like. So worldwide, there is also a realization now that we need to focus on conflict management efforts, and people are talking about we need to integrate within our undergraduate education courses of emergency, conflict resolution, things like that. So one of the tools that we use was the crisis management framework, and it has 4 stages. We try to use it to analyze our situation. So it has a preparatory stage, response stage, recovery stage, and mitigation stage. So if we consider the preparatory stage, which is mainly the purpose of it is to get ready to deal with the crisis and mitigate its immediate effects. During our short-lived transitional period, there were a lot of efforts for state building, and one of them was to put emergency plans. Unfortunately, they were not completed, and as with other war-affected nations, students' preparation is mandatory. In Syria, for example, they said if students acquire the basic knowledge of just saving, emergency techniques, they can save a lot of lives, and they started doing this. If we go to the response stage, the primary goal of this stage is to preserve life, sure, of course. And in medical education, we have other dimensions. Part of saving lives is trying to settle the students, trying to see for their safety, trying to consult them, trying to comfort them. If they have an issue that we can do for them as the university level, we try to offer them whatever we can to ease their lives. And success depends, of course, on effective planning and anticipation. And as I said, unfortunately, this was not done, although we are a country fested with crises. But however, there were responses, of course. People will not just stay there for death. They move. So, for example, the higher education, the Ministry of Higher Education and Research, they, from the beginning, at the start, they stopped everything. They stopped education all over the country. And this maybe was a shock response. It was not well thought of. And many of the universities, as you know, contested this, and they tried to say no. And then they said, if you open, then you are liable to what do you call it, sanctions. And this also confused the situation. And then in October, they said, no, all of you should open and should have plans by the end of October. So this confusion also impacted the universities. The institutes in war-affected zone immediately started, I know of many institutes, they started immediately to contact their students and to contact their faculty to see how are they doing, where are they, to locate them, and to start to find solutions. And also the institutes in safe states, they started to try and host people who are coming there. And even we need to look into what happened to these people, because they contributed to health services, they contributed to education, and they did to examination, and they did a marvelous work. So I think what happened made us see that solidarity during these times is the crucial word that we really need. In the recovery stage, which we hope that it will happen very soon, the focus should be on restoring normality. So the people routine, their normal life, the infrastructures, everything about restoring normality is in this stage. And it starts after the cessation of hostilities. So we cannot say that we started it unless hostilities stops. There are many efforts to be done, for example, starting by the community. The community has to be mobilized for peace building and conflict resolution. These are as Professor Mardi yesterday said rightly, people who made it through conflicts started by this, the reconciliation effort. So we need to start by this, to capitulate on the solidarity ingrained in our culture, like a nafir. So people were living on nafir in the past few years. Now this nafir can, which is a word, by the way, it's known, it's universal strategy. People, when they're in disaster, they come together and they help each other. To invite, of course, international collaboration from people who are like us, who suffered the same thing, and from the international community who's interested in humanitarian resolutions. And the last stage, it's the mitigation stage. During this stage, here true transformation awaits us that will guarantee that the paradigm shift in Sudan is permanent, that we are no longer going back to this black or this very bad, it's not color, very bad area or period of our time as humans. So this is really important because it is documented that 50% of the nations who come out of wars go back in less than 5 years. So we need to be really careful, inshallah. The lessons that are learned, it's still unfolding, of course, that is imperative to address historical issues rooted in colonial legacy, addressing the governance deficiencies and incomplete nation building. Till now, we don't have as a resolution. This is a problem. In a country, medical education must be reshaped into a model in our model of excellence that can be done through social accountability and through Sudan Med, which is also efforts about this conference is trying to do this, to advance this. Dr. Muhammad Al-Hassan Abdullah and Dr. Muhammad Al-Hassan Taha, they both worked a lot and they gave brilliant like suggestions on how social accountability can be the solution for our problems. And this is documented worldwide that it helps improve the people's health. So our recommendation is for other studies, because the picture is not complete. As I said, it's still unfolding. We need to revise what we wrote. Every day, new happenings occur, and we need to know what's happening in postgraduate medical education. Really very important. What are other health allied professions doing during this time? What happened to them? And we need to study the impact of displaced medical experts on medical education. It's a good, we think now it's good impact. We need to see that and how it's going to maintain after the war ceases, inshallah. And also the role of volunteering organizations. We know of SAPA, for example, the American Association, Sudanese American Associations. They did really great work to uplift the healthcare system. It's not directly related to medical education, but it is important to know about it. And so in conclusion, I would say that war, which is a destructive human conflict, impedes life and development. This is known. Despite trauma, it presents a unique opportunity for rebuilding a model of medical education with justice and community engagement, such as social accountability. And tools like this conference, community mobilization, and international support are crucial to put us in the right track. The whole purpose of education is to turn mirrors into windows. So let this wisdom inspire the transformation of diversity into adversity, into opportunity for kindness, justice, peace, prosperity, and radiant future for Sudan, inshallah. These are my references. And remember that من يحرم الرفق يحرم الخير كله, and to be kind whenever possible, and it's always possible. شكرا جزيلا لكم. Stay passionate. والما عنده محبة ما عنده الحبة. بارك الله فيكم. شكرا.
شكرا جزيلا دكتورة طاهرة. Very catchy words indeed. يعني it's a medal to be remembered and memorized all the way. And I think you touch upon a lot of important areas. And this particular topic, I think, is a cornerstone of what we can accomplish. And I think it triggers a lot of the insights and hopefully an actions from all the levels it can. Thank you once again, Dr. Tahra, for the presentation. Also, I'd like to remind my colleague to post their questions in the Q&A. Continuing our journey in the evidence-based practice in health professional education, I would like to invite Dr. Isra Abdullah Abdel Wahid, who will present to us an abstract titled Dental Education Amidst Chaos, Exploring the Consequence of War in Sudan. And I assume this topic will build and connect to what's being presented already by Dr. Tahra. Dr. Isra, please join us. The floor and the microphone is yours.
السلام عليكم.
وعليكم السلام ورحمة الله. You're not in the presentation mode, Dr. Isra.
Is it clear now?
We can see the PowerPoint, but it's not in the presentation mode. You can stop sharing and share once again, but the slideshow. We can also share the PowerPoint from our end if you want.
Just give me a second. Okay. I'll share it again. Yeah. Is it clear now?
Brilliant. You can start. Go ahead.
Okay. Bismillah wassalatu wassalamu ala rasulillah. Good evening, everyone. I'm Dr. Isra Abdullah Abdel Wahid Mahjoub, a lecturer in Faculty of Medicine, University of Al-Nilain. I'm a registrar of Community Medicine, Sudan Medical Specialization Board, and I'm a proud student of Masters of Health Professional Education, International University of Africa. Well, first I would like to thank the organizing and the scientific committee for giving me the chance to present my work today. Well, 1 month after the war, I was talking with some of my friends about the situation in Khartoum, and we were just chatting. They're both academic, Dr. Samar and Dr. Musab. We were chatting about the current situation in Khartoum and the destruction that happened to the universities. We saw some pictures on the social media. This is why we decided to do this research. It's about the effect of the war on dental education, entitled Dental Education Amidst Chaos, Exploring the Consequences of the War. This is the research team. Dr. Samar, she's a pediatric dentist. Dr. Musab, he's a restorative dentistry specialist. Dr. Amna, she's community medicine physician. Sarah and Abu Bakr, both of them are medical students in Faculty of Medicine, University of Khartoum, and Professor Muhammad Taha, he's a professor in University of Al-Sharqa. Well, as you all know, the war that started on the mid of April has worsened all the conditions of life, including the health and education. And as per the WHO, there were attacks directed toward the healthcare workers and facilities, which exacerbated the already worse condition for the healthcare system. Additionally, the ongoing war has disrupted the educational process in the medical schools, leading to shortage of faculty staff, the damage of infrastructure, and limited access to resources and safety concerns, as documented by Prof. Muhammad Taha. All of you have seen this picture. As Dr. Tahra, she already shared this picture of damage and to the education institutions. This is a picture of International University of Africa. Here is some disturbing pictures and videos even for troops in University of Khartoum in the medical campus, Al-Mashriq University, Ibn Sina University, Ribat University, and University of Medical Science and Technology. Despite of all this news and separate news, the accurate situation of health professional education in the country is still need to be clarified, including the extent of the damage to the higher education institutions and the impact of this conflict on the internship and on postgraduate training. Well, the objectives of this paper is to assess the effect of the ongoing conflict on the undergraduate dental education, universities, the internship, and the dental specialty training. Well, we used a mixed method, descriptive cross-sectional study, using both quantitative and qualitative methods. Well, regarding the study area and population, the study included 29 dental schools in the area affected by the war, including Khartoum State, Darfur, and Kordofan states, and the Marawi city. Additionally, the study included 5 key informants from the Board of Oral and Maxillofacial Surgery, the Board of Periodontic Dentistry, the Board of Pediatric Dentistry in Sudan Medical Specialization Board, the Training Administration, and the Human Resource Development Administration of the Federal Ministry of Health, and one university that provide orthodontics master's degree. Well, the quantitative data were collected using structured online Google form. The sources of data that we got was online searches and direct engagement of stakeholders, including staff, administrative staff, academic staff, administrative staff, students, and eyewitnesses. The study regarding the attacks on universities, we focused on the attacks that happened between the mid of April to the mid of July. Well, the qualitative data, we've conducted in-depth interviews using phone, using an open-ended questionnaire. And then the data was analyzed using content analysis. This is regarding the qualitative data. The quantitative was analyzed using SPSS version 26. Well, as a result, the results regarding the attacks of dental schools were, first of all, as I mentioned already, 29 schools were involved. 22 of them were private schools, 6 were public schools, and 2 were military related. Unfortunately, 79.3% of these schools were attacked. Keep in mind, this only happened in the first 3 months of the war. Well, regarding the attacks, according to the type of the university, 78.3 were private schools, and 13 were public schools, and 8.7 were military related. Regarding the extent of the damage or the damaged area inside the universities, in 8.7% lecture halls were attacked, in 8.7 student service facilities were affected, in 13% laboratories were attacked, and another 13% university wall and squares were destructed, and 34.8% administrative buildings were destructed. And unfortunately, in 43.5%, there was no information about the extent of the damage of the universities. Well, regarding the types of attacks, 60.9% of the faculties, dentistry faculties, were converted into military-based or used for military purposes. 73.9 were subjected to looting or stealing. 39.1 were subjected to destruction of the buildings, and 8.7 subjected to burning or fire was set in the setting. Well, regarding the mitigation measures, again, it's the long suspension of the academic years. 44.8% of the schools have converted to online education. 3.4% has started collaboration with other universities to continue the education process. 27.6% used both measures, online education and collaboration. And unfortunately, 24.2% they didn't use any measure to continue the education. Regarding the effect on the internship was seized directly after the events started, and it was limited only to two states, Jazeera and Red Sea states. We're talking about the direct effect of the war. Well, after that, the implemented solution in the country and abroad. In the country, the administration, the training administration, started to support the training centers in the safe states, and they have redistributed the interns in these states. This problem have solved. Solution have solved the problem for 40% of the house officers, but still there is hundreds waiting for their chance to start the internship. Regarding the abroad solution, there was an arrangement between the administration of the training and the medical council to approve the completed shifts, the internship shifts inside of Sudan, and allow the interns to continue their internship outside the country. Before the war, you have to choose either you do your full internship inside the country or outside. To solve the problem for those who started already the internship inside the country, they have introduced this solution. Well, regarding the difficulties in implementing the solution, first of all was the poor infrastructure in the dental centers in the safe states, the shortage of the specialists in these states, and more importantly, the communication difficulty that made it difficult for the training administration to map the locations of the specialists, to know where there is a specialist so they can send an interns there. Well, the approaches to improve the system for the future and mitigate future catastrophes and make the system more resilient, they have suggested only one solution to to have ready dental centers in all the Sudanese states. And I quote, "The war forced us to open new dental centers. We will suffer in the beginning, but in the end, when the centers is ready, it will be the opportunity. It will be an opportunity for the people who come after us." Well, regarding the effect of the war on the dental specialty training, the participants reported that in the conflict areas like Khartoum, Kordofan, and Darfur states, the training facilities became inaccessible, and there was disruption in the specialty training, specialties like pediatric dentistry, periodontic, oral, and maxillofacial surgery. Well, the second effect was the attacks, as one of the participants reported an attack on the training institution, but the extent of the damage was not confirmed. The third problem was the issuance of the certificate by the Sudanese Medical Specialization Board, which was interrupted by the conflict. Regarding the implemented solution in the country, the Sudan Medical Specialization Board have supported the training centers in the safe state, which positively affected these centers. The electronic certificates were introduced and sent via email to the participants. Regarding the abroad solutions, they tried to create an opportunities and support training outside, and there was also initiative of the dentist diaspora to help in solving this problem. Well, the difficulty that faced them while they're trying to implement this solution was, first of all, the psychological challenge on both ends, the trainees and the trainers, and poor infrastructure, as we mentioned already, in the dental centers in safe states. Regarding the abroad training, there was a problem in obtaining the license to practice in specific locations. For example, in Egypt, this challenge made it impossible for both the trainees and the trainers to practice in this country and to continue the education process. And I quote from participant 3, "In Egypt, after 2 months of preparing students and trainers in the regions and distributing them, we encountered the obstacle of the license. We paused the clinical plan and shifted our focus toward the research until conditions calmed down." Regarding the future suggestions to improve the system was having ready-made dental centers in the Sudanese states, collaboration with the training bodies outside the country, increasing online education, and importantly, improve the electronic system and build service clouds and backup to save the candidates' data and ensure data availability when needed. Well, as a conclusion, the conflict had a detrimental effect on both undergraduate and postgraduate dental training. Urgent interventions are needed now to mitigate the consequences. However, long-term strategies is needed to make the dental training in Sudan more resilient. Here's the references. Thank you all for your time and for listening. Always pray for Sudan. Here's my contact, a personal contact, Isra Mahjoub at Gmail. 1% Research Initiative is an initiative that I have created after the war to improve the collaboration between the researchers in Sudan and to build their skills by giving them a chance to contribute in real research. And this was one of the researchers of 1% group. We are open for collaboration, so feel free to contact me and either my personal or the professional email, and you have my phone number. Thank you so much.
Thank you very much indeed, Dr. Isra. Very informative presentation. You shed the light in very important areas, and indeed, one of the strategies that we mitigate such challenging situation is to support the evidence-based practice efforts, and that's of course uh, driven by research in different areas and in health professional education. Yes, once again, please post your question for Dr. Isra on the Q&A section. We'll get into it in a few minutes. The last presentation for today, last abstract presentation for today, I would like to invite Dr. Maryam Abdel Qadir Haju. She will talk about hard work titled Perception of Medical Students Toward Obstetrics and Gynecology Simulation Based Medical Education in a Milan University 2022. Dr. Maryam, the floor and the microphone is yours. All right, it seems that Dr. Maryam is facing a bit issues to join. Probably I'll take this opportunity to, I would like first to invite all our speakers in the last session. Probably I'll pass some of the question, and probably I'll start by Professor Ahmed. Professor Ahmed, you talk in your presentation about the core clinical procedures, skill learning, the undergrad in public medical school. So my question is, what were the most significant barriers based on the study that the undergrad medical student faced in acquiring the core clinical procedure skills, and how did they overcome them based on your efforts in this study?
Okay, thank you, Dr. Sham. I think the undergrad medical student face a big problem in structured training of procedure skills. In fact, actually, there is no curricular document showing to what extent they should learn procedure skills, because procedure skills are in different specialties like in ENT, obstetric and gynecology. We need the undergrad medical student to have different various levels. But with regard of this essential or core clinical procedure skills, all the frameworks stated that these are mandatory skills. The medical student should be competent at, not just knowing about it, not just seeing it. He should be competent at the first step when he leave the medical school. So our students, they face that there is no clear instructional design, and for that reason their gain is very low. Another point is that our medical schools are very poorly equipped with skill labs or simulation training. And this is the basic requirement for performing procedures at different levels, even in postgrad level. I think if I highlighted the answer for your question.
Thank you very much indeed, Professor Ahmed. You absolutely covered the question. I have another question here for Dr. Marwa. So I'd like to invite you to the stage. The question is, how do the various learning styles of dental students impact the satisfaction and the outcomes with e-learning platforms like Moodle? And did you touch upon other, other incidental findings, whether related to other e-learning platform or other aspects related to teaching and learning in your study?
Okay. As a result, there is no relation between satisfaction toward e-learning and learning style. Okay. Um, the other question, what? The next part?
Yeah, the next part, did you touch upon any other findings while you're conducting your study when it comes to the perception of students regarding other e-learning platform, not particularly Moodle, or other teaching and learning areas?
No, just on Moodle, according because this was at Nilan University, and they just used Moodle at that time.
Perfect, perfect. Thank you very much. And I think
Welcome.
what will add that result to all these efforts, that yes, it's very important to consider the perception of the students when it comes to technology options to carry out the education continuity. And yes, thank you. We'd like to thank you and the co-authors in putting the efforts in that area. Very important, and definitely it's an area of need now.
It was
I
for
would like also,
COVID-19. It was for COVID-19, but now it's changed to other.
yeah, indeed, indeed, and that's actually what we've been calling to in this conference when it comes to crisis, whether it's COVID-19 or even armed conflicts or otherwise, probably floods or other natural hazards related disasters. It's still is still we need to put the education continuity in front of our eyes, and we leverage all the efforts here and there to make this happen. And I think your abstract added a value in that context. Thank you very much.
Thank you.
I'd like to call also Dr. Tahra Sadiq. There's a question here from Dr. Abir. Uh, she asked that activation of previously created links and connections with international communities to accommodate our resident trainings and preparation for post-war Sudan, the process and the progression. That's a note from Dr. Abir. A very extensive one, yes, and I think we need another session to answer this question.
Yeah, exactly. Thank you very much, Dr. Abir. Sorry, I have to. Okay, no problem. There are a lot of efforts now going on, of course, and the let's say the picture is not 100% clear now, but I know of a lot of institutions. You're talking about Sudan Medical Specialization Board, I guess. I'm not sure about the Sudan Medical Specialization Board specifically. Maybe Dr. Ahmed will know more than myself, but I know in the undergraduate education, a lot are communicating with the institution which provided education, medical education for Ukraine now and still providing it. And they are happy, and they said they were happy to help Sudan and to work together. But as I said, things are still unfolding, and we exactly don't know what's going to happen. I think before like some sort of horizon appears, everything is now very volatile. But maybe someone will know what happened in Sudan Medical Specialization Board. Till now, they're trying to mitigate the problems. They're trying to get the certificates and do such things. So the planning stage, I think it's a bit difficult now because the students there, the trainees, are really in a critical situation. Thank you.
Thank you very much. And again, I think one of the things that we learned already from this situation is that the more we spend on the preparedness, the more we spend on the mitigation activities, and we start on that as soon as possible, the more we become resilient. And yes, there is a bright side for this story. It's not all dark stories, if you would. And ما لا يقتلني يقويني. Well, let's start now. And the more we put effort on those areas, definitely the outcomes will be remarkable. Lastly but not least, I have a question. Go ahead, Dr. Ahmed. Would you like to add
Yes,
anything?
with regard to the last point mentioned by Dr. Tahra, actually, I'm the head of the training committee at the General Surgery Council Sudan Medical Specialization Board. In fact, we started earlier after the migration of the people to do survey. We conducted survey to look at where are our candidate, our trainers. Is it possible to continue training? And we named the mission training during war. In fact, we managed to redistribute the most of the candidate in general surgery. It's almost extending more than 90% of the candidate or trainers are now engaged in training. We managed to find channels abroad in Egypt and in Saudi Arabia and Qatar and in Ireland to train our candidate. Also, the medical specialization board has opened an office in Dot Madani, this in the past, for mitigation of a lot of problem regarding certificates for the graduate, and things are going.
Thank you very much, Professor. Good news you mentioned already. Thank you very much. Probably I will link your comment and Dr. Tahra respond to a question that I would like to call Dr. Isra for. Dr. Isra, in your presentation, based on your study, could you please elaborate on the most urgent needs and challenges you touch upon in your study facing the dental education during times of conflicts?
Assalamu alaikum. Well, regarding the undergraduate training, I guess we have to study the applicability of this in the current situation. I know many universities and many schools, maybe some of us are teaching in, they are implementing online education without doing a feasibility study for the students. So I'm not sure if this is fair. We are just providing an equitable education at this time. Regarding the postgraduate training and the internship, what we saw when we were conducting the interviews with the key informants is that there was no any kind of collaboration between the HRH, the training administration and HRH and the Federal Ministry of Health, and between the Sudanese Medical Specialization Board. The training administration, they've stated that they don't have a map, that the problems of the communication had made it difficult for them to map the specialist and where they are. On the other hand, the Sudanese Medical Specialization Board, they have already done this, and they know the exact places of each board. They know exactly where is the trainers are. So just a simple collaboration between the health providing authorities and stakeholders can solve some of the problems of the education. For me, this is the urgent point, to have some of the collaboration between the Federal Ministry of Health and the Sudan Medical Specialization to improve the chances for the training for the registrars.
Thank you very much, Dr. Isran. And again, I salute you for the effort and the initiative for supporting the evidence-based practice. And I hope what we have here in the virtual platform is a table that all the participants can join those rooms to share and discuss and engage in more fruitful discussions related to what's being presented or is going to be presented. So please, please continue this discussion, and I think this is for today. Professor Saad, would you like to add any final
And
remarks?
I want to ask a question while everybody is here, because somebody asked me, where would we find these recordings? Because we went to the website and we didn't know where to go. And you now talked about resources, recordings. Where are they?
Perfect. So once the session ended, you need to go back to the sessions view. So each session completed and ended, the same icon that you click on it to join the session, to the right of it, there is another icon that will appear after the session completed. This icon called play, watch replay. So all previous session, when you click watch replay, you can see it, watch it at any time in the virtual platform.
But this one, you cannot see it while you are still in a session.
So we need to close the session first, and then then it will be uploaded to the cloud. And after the closure of the session by 1 minute, you can see the whole session once again.
Okay. I got it. It is next to go backstage. Next to it is watch replay.
Yes.
Yeah,
yes.
But they are inactive now for all the sessions. Okay.
For the previous session, it's active. For this session, it's not active.
Okay. Thank you very much.
So thank you very much. As we draw the curtains now in the illuminating of first day of ShirtCon 2023, we'd like to express once again our heartfelt gratitude to all the speakers, moderators, and attendees who contributed to the vibrant discussions actually, and the sharing of the invaluable knowledge. So your engagement is very important, and it's very enthusiastic, and it has been the backbone of today's success. Now, the journey doesn't end today. I would like here eagerly to invite you to the anticipated continuation of this intellectual feast on day 2, tomorrow, inshallah ta'ala. So expect to dive deeper into the wealth of topic, and we promise to broaden our horizon and discuss more interesting topic with our esteemed speakers. So yes, from resilience of health education to turbulent times, to the latest educational technology and quality assurance evidence-based practice. Tomorrow we will touch upon some interesting topic like the assessment and evaluation technique during the disruptions. We'll also talk about the educational resilience, where we will have some experts that can support and shed the light on one of the important area of education resilience. And we're also going to have dialogues around the simulation and medical training, and probably we will we'll have also a talk about the concept of quality in health profession education, and how will it support driving efforts towards the continuity of education. So once again, we invite you to join us tomorrow and bring your insights, your questions, your curiosity, and yes, remember we'll start tomorrow, inshallah ta'ala, based on the schedule available on the virtual session. The platform is already set it to have more engagement, more discussion. So have your coffee, your virtual coffee in our virtual platform. We'll try to collect every single resource available or suggested from our esteemed speakers, and we are going to upload it once again to the virtual platform in the resources area. Try always to join the session 15 minutes prior its start to stay punctual to our calendar. Once again, thank you very much, Professor Sahel, Dr. Tahra, Professor Ali Zayad, Professor Ahmed, Dr. Isra, Dr. ميساء, Dr. مروة, دكتورة دعاء، وبقية الأعضاء والزملاء اللجنة التنظيمية، الحضور وبقية المتحدثين خلال اليوم. ونختم بسبحانك اللهم وبحمدك، نشهد أن لا إله إلا أنت، نستغفرك ونتوب إليك، إلى أن نلقاكم بإذن الله تعالى غدا في لقاء متجدد. السلام عليكم ورحمة الله تعالى وبركاته.
وعليكم السلام ورحمة الله تعالى وبركاته.
عليكم السلام ورحمة الله. شكرا.
Thank you very much.